CI 650.
When you're smiling,
When you're smiling,
when you're smiling,
when you're smiling,
and the whole world smiles with you.
smiles with you.
And when you're laughing,
When you're laughing,
oh, you're laughing.
oh, you're laughing,
When the sun comes shining through.
shining through.
When you're smiling. Now, Dr. Ron Zokol, did you know, this is truth, women actually smile more than men do?
Oh,
Do you know why that is? Because most cases are not married to other women. Sorry. Just a
Pass.
pass on that. But we've talked about this on the show before with you, Dr. Ron, that many times you do see more women than men because mostly women care about themselves and they seem to be the caregiver of the family.
I think there might be a good reason for that, and I think you might be right as far as being the care. But they're also, in many cases, the people who have the time. And I see the men who come in often are doing so with the encouragement of their ladies.
That's a nice way to put it.
Well, yes, it is.
Yeah. But she can say to him, we're doing this for you, dear.
She can.
And in reality, she is doing it for him.
Yeah. Well, they're doing it for the both of them, really.
Yeah.
And when you're at a position, we're coming to see us at BC Perio, we're coming in here, the treatment that we provide, we don't do the single stuff. You got a simple problem. We'll see you and we will help you and we may even treat you. Our main focus is a person who really has some issues. And one of the things is even though people have a sense that they might have a singular problem, oh, I got a problem right here, doctor, and have a look at it, and they say, can you fix that part of it? In reality, what might be happening in other areas of the mouth, other things which are contributing to that issue right there that are not obvious to that patient. And it's our responsibility to see how these things all connect and come together. And from time to time, we see things that are much more advanced than others do. And of course, our responsibility, as far as we're concerned, is to at least make you aware of it. So we do a very, very thorough analysis of how you got to where you are today.
Let's suppose I go into your office here in Vancouver because I live in Vancouver. And I get out the elevator, I go through those big glass doors, they call my name, I go in to see you. I'm here for my free consultation, by the way. What happens then? I sit in the chair, you say hello, I say hello, and then what?
Yes, well, one of the things you do is you fill out a bit of a medical history so we have some understanding of your health in general.
And that's important.
And it's very important to us if we prescribe medications or have some issues that we see. We need to sometimes know who your physician is, whether you have some issues with your medical health as well, because these can correlate to some degree. And we may have to have a chat with your physician if you are on a lot of medications and we have to prescribe medications. We want to do that in harmony with what your doctor is giving you as well. So the medical history is an important part. So we do that. We take a CT scan, which is a three-dimensional scan of your mouth and structures around your mouth so that we can see three-dimensionally what your radiographic information provides.
And there's a lot less radiation than from a regular X-ray,
Yeah,
right?
this is where the technology is absolutely spectacular. What we do, this methodology of taking an X-ray in 3 dimensions is usually very, very massive in the amount of X-ray radiation that exposes a patient. Not in our case. We have the latest technology in the world that allows us to take those things at such a small X-ray footprint as you could ever imagine. And it's like being out in the afternoon sun for a couple of hours, and that's all the radiation you get. And we get all this information. And we feel it's so valuable to us to see it that we do this complimentary.
You love this kind of work. I asked him a simple question. The man's face lights up. You're like a little kid eating a piece of chocolate cake. You're just loving it. You obviously like and love what you do.
I do.
Yeah.
I find it exhilarating. Every case is like a detective series where you've got to find out what the causative factors are. You got to do the analysis. You got to see the influencing factors, and you got to see what's on the horizon if nothing is done, and what's going to happen if you treat and plan this way, and know what the future lies, and design a solution so that the future is stable, and that's the goal, really.
Can you go home from work at night and leave the job at work? Or are you thinking in your mind, how can I fix this guy's tooth?
I know I can leave it behind.
Can you?
Oh, absolutely, I can. The beauty of being in this field for so long is that you've got your techniques and systems in place, So I can see somebody do the analysis, work it out, understand, put the documentation in place, and walk away, and just refer to my documentation next time I see our patient, and go from there.
So chances are then there's nothing really new coming through that front door. In most cases.
Yes, it's not new from the sense of the individual components that compromise somebody's dental health, but it is, every case is different because of the multitude and the severity and the interplay between the difficult problems. Everybody comes in with a different amount of bite, the way the teeth come together, and they impart different forces and the disease patterns that are there. While the diseases are similar in context, they may not be similar in reality, and certainly your treatment protocols might have to be adjusted because of any number of those factors.
And there's an old expression, everybody's different.
Everybody's different. So when people say, Doc, I got a problem here, what's it going to cost to do this? I'll say, well, I'll tell you what, as much as I'd like to quote you a number here, I really can't, and be honest about it. I really need to see what's actually happening there so I can understand that if I do this for you, that you're not going to have a problem afterwards in some other way. So I need to see what's going on, evaluate it before I quote you a fee and a particular protocol that we're going to go through if you accept it, and knowing how we're going to rehabilitate that area.
Now, if somebody would like to get some more information, or if you'd like to book an appointment during the week in Vancouver, the telephone number to call is 604-872-0222, 604-872-0222. The address is 777 West Broadway. That's Broadway at Willow. And the suite number is 501. So that's 501-777 West Broadway, Broadway at Willow, 604-872-0222. If you live in the Tri-Cities area out in Coquitlam, there's a clinic for you as well. It's number 250, 1175 Johnson Street at Glen Drive. 250, 1175 Johnson Street at Glen Drive. The telephone number in the Tri-Cities, 604-936-8244. 604-936-8244. Dr. Ron, before the show, you and I were having a cup of, got to be careful here, vegetable juice. Okay, we're having a coffee.
Different type of vegetable.
Well, actually, it's not a vegetable. It's a bean.
It's a bean. Yes.
But I was telling you about this guy that I know, and he was down having one of those all-you-can-eat $12.95 buffet lunches, and he broke a tooth. And he told me, he says, "No, I'm just going to leave it." I said, I'm the doctor, right? I said, "Well, I don't think that's a good idea." I said, "I think you should maybe have somebody look at that." And he showed me, and the little tooth was jagged there, and he says, "Oh, the dentist is just going to slap some stuff on there, and off I go." I said, I don't know about that, but go to the dentist. Was that the right thing to say to this guy?
It's a smart thing.
Thank you.
Well, the dentist can confirm whether you can leave it without consequence, or if you leave it, that there's going to be this problem showing up. So, you know, in any type of a fractured tooth, there's a difference between a little chip, technically, on the edge of the tooth, which now you have a tooth that doesn't look the same and it's got some sharp edges, or another one where you fracture off a large component, it gets into the pulp, into the nerve area of the tooth, and if that's not really painful right now, it's going to become painful in the future.
Ah, okay.
Yeah, so
I did the right thing.
Yeah, absolutely.
I've been hanging out with you far too long. I wanted to talk about teeth in a day, and we're going to go to a commercial break, but let's just quickly, let's do the thumbnail sketch of tooth in a day. Teeth in a day?
Teeth in a day
Can
or
happen?
tooth in a day, yes.
Or tooth, or one tooth, two teeth?
One tooth or a whole mouth of teeth.
Really?
All in one day.
And who's a good candidate for that?
Anybody who's got a missing tooth that could use another tooth in that space without cutting down all the other teeth around it.
So could I get the background on tooth in a day and teeth in a day in just a minute?
Yeah, sure. Your tooth in a day is where you take a tooth out, or if you have a space with no tooth in it, then you put an implant in, and you add a tooth on that very, very same day and attach it to the implant.
See, now that's why you're the specialist, because I'm totally confused here. That's why I come down to see you in your office at BC Perio. And by the way, the telephone numbers again in Vancouver, if you want to make a call and talk to Dr. Ron Zokol, or make an appointment so Dr. Ron Zokol can look in your mouth and say, "Hey, this is good, this is not so good, here's what we can do for you. We'll make you smile, look like $1 million in no time." 604-872-0222 is the telephone number at the Broadway office. 604-872-0222. The address is 777 West Broadway, Broadway at Willow. In Coquitlam, it's number 250, 1175 Johnson Street at Glen Drive. And your telephone number there is 604-936-8244. It's Boomer Life. I'm Tom Lucas. Our guest in studio today is Dr. Ron Zokol, and you got more coming right up.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.